Bismillahirrahmanirrahim. Today we will be discussing some important university questions from the topic of blood vessels due to this pandemic, because we will be unable to take your class test, and the majority of the class tests will be on Socrative and MCQ based. So I decided to share with you some of the past paper university questions, and these will be very helpful to you because majority of the questions from the cardiovascular system come from the chapter of blood vessels. So we will be revising these topics in relation to these university questions. So this is the question number 1, and it came in this year of pathology, special pathology paper in February 2021. So the question is, a 58 years old male felt substernal pain with breathing difficulty, and he died on the way to the hospital. And on autopsy, there were thickened walls of many arteries, including the coronary arteries with narrowing. So the lesions consisted of raised plaques with soft centers. So this is a scenario. So you should revise, and this is basically a brainstorming question. So the questions are, part A, what is the name of the disease process forming the plaques? Draw and label the microscopic features of the plaque lesion. And the third question is, give an overview of its major pathogenic pathways. So it is a very important question. So the answer of part A is the disease Arteriosclerosis. Of part B is the diagrammatic representation of atheromatous plaque and its major parts. The atheromatous plaque is composed of the fibrous cap, as you already know, comprising of smooth muscle cells, the macrophages, foam cells, lymphocytes, and the extracellular matrix substances, including the collagen, the proteoglycans, and the new blood vessels, that is the neovascularization. And the necrotic center is composed of cholesterol crystals, the cell debris, the foam cells, and the calcium. So this diagram, as I previously mentioned, is highly important, and it came in many university questions. So this is the answer of part B. And the answer of part C is that you have to either draw this diagram because it is explaining beautifully the major pathogenic pathway of a atherosclerosis, or either you can write down these parts in either the tabulated form or simple writing. So the first step is endothelial injury and dysfunction as a result of certain precursor lesions, including hyperlipidemia, hypertension, smoking, and certain toxins. So as a result of which there is accumulation of lipoproteins and its oxidized form within the vessel wall, or the recruitment of leukocyte and monocytes. These monocytes and the platelets migrate into the intima, where they are transformed into the tissue macrophages. And as a result of the certain factors releasing from the blood platelets, there is smooth muscle cell migration from the tunica media to the tunica intima, where they undergo proliferation and synthesize the extracellular matrix, that is the proteoglycan and collagen and elastin. So these components constitute the fibrous cap. And afterwards, these macrophages and smooth muscle cell engulf the lipid, that is the oxidized LDL, as a result of hyperlipidemia, and form the foam cells that form the necrotic center or the core of this atheromatous plaque. So it is a response to the injury hypothesis. So it is the major pathogenesis of atherosclerosis. This is another diagram showing the detailed influx of LDL, its conversion into oxidized form, and transformation of macrophages and the smooth muscle cells from the media into the foam cells. So this is the answer of part C. Now coming to the question number 2. This is a 55-year-old man who was an alcoholic and fond of red meat, suffered a short episode of unexplained chest pain. And at autopsy, the pathologist found thickened walls of many arteries, including the coronary arteries, and the lesions consist of raised plaques having soft fibrous core and a white cap. So this is more or less the same question, just like the question number 1. So here the questions, the parts that are asking are somewhat a little bit different. So this is the same question from the topic of atherosclerosis. So the part A is the what is the process known as and what other arteries are most commonly involved? And part B is what are the principal components of these plaques? Of question A is atherosclerosis, and the arteries that are involved are the large elastic arteries including the aorta, the carotid and the iliac arteries, and the medium-sized muscular arteries including the coronary and the popliteal arteries. So the answer of part B is either you can draw the diagram as I have shown you in the previous question, and because they have asked the principal components, so these are the principal components. The cells including the smooth muscle cells, the macrophages and the T cells, and the extracellular matrix including the collagen, elastic fibers and the proteoglycans, and the third component is the intracellular and the extracellular lipid. So this is the second question, and it came from the same topic of atherosclerosis. And the question that was asked in part B is the pathogenesis of the most frequent and important pattern. So you have to write down the pathogen mentioned in the previous slides, the same diagram of the response to injuries. Now coming to the question 4, that is the last question in today's presentation. Enumerate the 6 causes of secondary hypertension. Name 2 lesions of the small blood vessels that are associated with hypertension, and write down their microscopic features. So as you already know, the primary hypertension is the hypertension that is idiopathic, that is the cause is unknown, and the secondary hypertension is the hypertension that occurs secondary to renal, endocrine, cardiovascular and the neurological diseases. So among these, in this table, you have to only write down only the 6 causes of secondary hypertension. You could write either the 2 of the renal causes, 2 of the endocrine causes, and 2 among the cardiovascular diseases and the neurological condition. And the most important causes of secondary hypertension, you can write renal disorder including the glomerulonephritis and the renal artery stenosis, endocrine disorders including the Cushing syndrome, the pheochromocytoma, and among the cardiovascular diseases you can say the coarctation of aorta, and among the neurological causes you can write the raised intracranial pressure. So the 2 forms of small blood vessel disease that occurs in hypertension are the hyaline arteriosclerosis and the hyperplastic arteriosclerosis. So this is the answer of part B. And the part C, in the part C, they are asking you about the microscopic features of these 2. So in hyaline arteriosclerosis, there is deposition of homogeneous pink hyaline substance within the walls of the arterioles within the tunica intima layer, with loss of underlying structural detail and narrowing of lumen. So it is due to the plasma protein leakage across the injured endothelial cells and increased smooth muscle cell matrix synthesis. So in hyperplastic arteriosclerosis, this condition is related to acute or severe elevation of blood pressure, that is the malignant hypertension. So in this case, there is concentric, laminated or onion skin thickening of the walls of the arterioles with luminal narrowing. So the laminations consist of smooth muscle cells and thickened duplicated basement membrane. So this is the answer of part C. So I hope that this lecture would be very helpful in solving your past paper, and it has revived your knowledge of the previous lectures that I have delivered regarding the blood vessels. In our next lecture, we will cover some of the other university questions. So thank you so much for listening.